over 7 exercises for lower back pain. Exercise is crucial for lower back stability. Strengthening your core is also really important to prevent lower back injuries from reoccurring. Equally as important is stretching. So, a little plug here. Take a moment, if you like these kind of videos, to click the red subscribe button below. And if you like this video, I hope you give us a thumbs up. Now, let's get into those 7 of my favorite lower back pain exercises. A common postural deviation we find with lower back pain is called lower cross syndrome. Here in this picture you see with lower cross syndrome, someone has tight back muscles or erector spinae muscles along the spine, and then tight hip flexor muscles in the front of the legs, along with weakness in the abdominals and the glute muscles. We're going to show you some exercises how to strengthen those areas. The glute muscles are very important to exercise with lower back pain. They're responsible for leg abduction and leg extension. This next exercise is called lateral leg raises. Just simply lay on a yoga mat or a floor and laterally raise your leg. You can add weights on your ankles later to gain more strength. Make sure you do this bilaterally for both the right and left leg. This exercise focuses on strengthening the glute minimus, medius, and maximus. This video again is going to focus on the muscles that are most commonly weak with lower back pain, which are the glutes and the abdominals. This next exercise is called the Clam. You can start this exercise without a TheraBand. I'll leave a link below where you can purchase one of these round bands. During the Clam exercise, the main target muscles are the glute maximus, superior portion, and the glute medius. It makes sense because in this exercise, we're mainly abducting and externally rotating the hip joint. Now for the bent knee exercise. This exercise targets the gluteus maximus, you see colored here in red. The reason why we have the knee bent is because we want to take the hamstring out of this exercise and isolate the glute maximus. This exercise also works a little bit of the glute medius and the erector spinae muscles that stabilize the spine. And one of my favorite exercises, the plank. This exercise is crucial for spinal stability and core stability. In this exercise, you're going to engage your abdominal muscles, and this will help to stabilize the upper chest and the lower pelvis. As you can see here, the proper technique, you want to make sure your spine and neck and head and legs are in a straight line. By doing a plank, you increase intra-abdominal pressure, thereby alleviating pressure off the lower spine. This next exercise is a lateral bridge using body weight. You'll notice there are 2 ways to do this. Variation A, the spine is in a neutral position. So no bending of the spine, it's bending at the hip joint. In variation A, the spine is not only in a neutral position, but all the muscles around the torso stiffen to ensure stability and abdominal bracing. The target muscles are the quadratus lumborum, multifidus, and also the erector spinae muscles in the longissimus and iliocostalis muscles. The longissimus and iliocostalis travel the full length of the spine from the base of the head all the way down to the lower back, and not only extend the spine, but also help in lateral flexion of the spine. In variation B, we're targeting the same muscles, but with more spinal lateral flexion. If these muscles are too tight or there's imbalance because you've forgotten to strengthen your abdominals, this could create anterior pelvis or what we call lower cross syndrome. During the abdominal crunch or sit-up, we want to target all the abdominal muscles. It's important to understand if you have pelvic floor dysfunction, you may want to avoid abdominal crunches or sit-ups. And this 30-degree angle you see here is important. When doing a sit-up, you're increasing pressure on the lumbar spine if you lift up too high. So it's important just to lift the shoulder blades up off the ground, and you never want to pull on your neck with your hands.
You just want to place your hands behind your head and neck for support. Don't forget to like this video and subscribe to our YouTube channel. In this last exercise, we're going to be targeting the external and internal obliques. It's the same as a sit-up, except we're going to bring the elbow across the body towards the hip. And you'll notice it's a really slight motion. We don't want to increase pressure on the lumbar spine. We want to keep the lumbar spine flat on the ground. These are my 7 favorite exercises for low back pain and to fix lower cross syndrome. If you continue to have back pain, don't hesitate to call us or comment below.